السلام عليكم ورحمة الله، ومرحبا بكم مجددا في محاضرة جديدة من سلسلة محاضراتنا عن مراجعة أسئلة اختبارات البرومترك Review of Prometric Test Question. This is lecture number 7 in pediatric nursing. Today we are going to discuss 5 questions from question number 184 up to question number 188. معكم محمد عثمان يحيى. نبدأ مباشرة. Question number 184. The clinic nurse reviews the record of an infant and notes that the healthcare provider has documented a diagnosis of suspected Hirschsprung disease. The nurse reviews the assessment finding documented in the record, knowing that which sign most likely lead the mother to seek health care for the infant. The options are number A, diarrhea, number B, projectile vomiting, number C, regurgitation of feeding, number D, full smelling ribbon-like stool. وقف الفيديو هنا اختار الخيار بالشوف صحيح. The correct option is option number D. ليه اخترنا الخيار رقم دي؟ نشوف rational. Hirschsprung disease, also known as congenital aganglionic megacolon, occurs as the result of absence of ganglion cells in the affected intestine. Chronic constipation beginning in the first months of life and resulting in the ribbon-like stool that are full smelling is a clinical manifestation of this disorder. So the correct option is option number D. Delayed or absence of meconium and bowel obstruction in the neonatal period, abdominal pain and distension, in addition to failure to thrive, are also clinical manifestation. The options number A and number B and C are not associated specifically with the disease. Question number 185. An infant has just returned to the nursing unit after surgical repair of a cleft lip on the right side. The nurse should place the infant in which best position at this time? The options are number A, prone position, number B, on the stomach, number C, left lateral position, number D, right lateral position. وقف الفيديو هنا واختار الخيار اللي بتشوفه صحيح. The correct option is option number C, left lateral position. اللي اخترنا الخيار رقم C نشوف rational. A cleft lip is a congenital anomaly that occurs as a result of failure of soft tissue or bony structure to fuse during embryonic development. After repair, the cleft lip avoids positioning the infant on repair side or in prone position because of rubbing of the surgical site on the mattress. The position should be on the side lateral to the repair or on the back upright to prevent airway obstruction by secretion, blood or tongue. So the correct option is option number C. Question number 186. The nurse reviews the record of a newborn infant and note that a diagnosis of esophageal atresia with tracheoesophageal fistula is suspected. The nurse expects to note which most likely sign of this condition documented in the record. The options are number A, incessant crying, number B, coughing at night time, number C, choking with feeding, number D, severe projectile vomiting. وقف الفيديو هنا اختار الخيار بالشوسة. The correct option is option number C, choking with feedings. ليه اخترنا الخيار رقم C؟ نشوف rational. In esophageal atresia and tracheoesophageal fistula, the esophagus terminates before it reaches the stomach, ending in blind bush. And a fistula is present that forms an unnatural connection with the trachea. Any child who exhibits the three C's, which are coughing and choking with feeding and unexplained cyanosis, should be suspected to have tracheoesophageal fistula. So the correct option is option number C. Option number A and B and D are not specifically associated with this disease. Question number 187. The nurse provides feeding instruction to a parent of an infant diagnosed with gastroesophageal reflux disease. Which instruction should the nurse give to the parent to assist in reducing the episodes of emesis? The options are: number A, provide less frequent and larger feeding. Number B, birth the infant less frequently during feeding. Number C, thin the feeding by adding water to the formula. Number D, thicken the feeding by adding rice cereal to the formula. وقف الفيديو هنا واختار الخيار اللي بتشوفه سهل. The correct option is option number D. اللي اخترنا الخيار رقم D نشوف rational. Gastroesophageal reflux is backflow of gastric content into the esophagus as a result of relaxation or incompetence of the lower esophageal fistula. Small, more frequent feeding with frequent burping are prescribed in the treatment of gastroesophageal reflux. Feeding thickened with rice cereal may reduce episode of emesis. So the correct option is option number D. Question number 188. A child is hospitalized because of persistent vomiting. The nurse should monitor the child closely for which problem. The options are: number A, diarrhea. Number B, metabolic acidosis. Number C, metabolic alkalosis. Number D, hyperactive bowel sound. وقف الفيديو هنا واختار الخيار بتشوفه صحيح. The correct option is option number C, metabolic alkalosis. اللي يختار الخيار رقم C نشوف rational. Vomiting causes the loss of hydrochloric acid and subsequent metabolic alkalosis. So the correct option is option number C. Metabolic acidosis will occur in a child experiencing diarrhea because of the loss of bicarbonate. Diarrhea might or might not accompany vomiting, and hyperactive bowel sound are not associated with vomiting. شكرا جزيلا، نتقابل في محاضرة جاية. Don't forget to support us by comment, like or subscribe.